Good evening, everyone. Can we get started? Good. Please, if you are seated at the back, I invite you to sit at the front tables because there's going to be a little bit of a workshop and the side event. So the material is in here in the front tables. Well, I would like to know a little bit where you're from. So I'm Rafaela, and this side event is called Teaching Planetary Health Through Complexity Thinking, a Patient-Centered Approach Through the Lens of Planetary Health. And the team that is going to present today is people from Brazil. We have been teaching planetary health using a method that I'm going to explain, and you're going to practice it also. So I would like to hear where you guys from, and also I would like to say thank you for everyone who is watching at home. I know there's some people there also. Where's the microphone? Oh, there. Could you say where you're from? Hi.
Is it? Yes. Yeah. Hi, I'm Camila. I'm from Brazil as well. It's my first time in the group of Planetary Health Alliance, and I'm very interested to know what are you doing. I've heard about it last year, and I'm trying to get in touch.
Thank you. And what about you?
My name is Amy, and I live in the Baltimore, Washington, D.C. area, so not terribly far from here, and this is my first time attending this conference as well.
Chris, first time attending. I'm coming from St. Louis, which is in the middle part of the country.
Roberto, I'm from Brazil too, and this is my second conference of planetary health, and I'm involved with these ideas in Brazil too.
Hello, I'm João Paulo, and I'm also from Brazil, and this is my first time here in the Planetary Health Conference.
Hello, my name's Airton. I work for the OSHA Center for Integrated Medicine. This is the first time I'm here.
Hi, I'm Andrea from Austria.
Hi, I'm Jennifer from Massachusetts, and it's my second time here.
Hi, my name is Tatiana. I'm that Tatiana over there, and I'm an education fellow here at Planetary Health Alliance, and I am Rafaela's advisor in her master's.
She's an excellent teacher.
Yeah. Sorry, Carlos. I am from Brazil, from South Brazil.
Hi, everyone. I'm Carlos Byron. I'm the Associate Director of the Planetary Health Alliance. I am based in Costa Rica. I am a Costa Rican.
Hello, everyone. I am Raquel Santiago from Brazil, and I live in the middle of Brazil, and it is my second time here.
Hi, my name is Marcos Moura. Here, I'm from Brazil, the first time in conference.
Hi, I'm Enrique, over there as well, and I live in South Brazil, and Tatiana is my wife, so I obey her.
Hi, I'm Ariana Moreno, and I come from Barcelona in Spain.
There.
Hello, my name is Monica. I am Rafaela's mom.
She came to worship a little bit.
Hi, everyone. My name is Nelzair. I am a researcher in public health at Oswaldo Cruz Foundation, Brazil. This is a third time in conference.
Oh.
And
Nelzair is also. Oh yeah, here.
Okay.
So thank you. I love to know where you guys are from. I am a family doctor. I work in a healthcare unit in South Brazil. And also I'm a master's student, and my research is about teaching planetary health. So this is what I'm going to show you that we have been doing. So first of all, please look at this map design that we did with elements of planetary health. And here are some of the elements that are in the map. So it's kind of, it shows like this complexity thinking, this all elements, just introducing what we're going to do today. So we have had a lot of experiences, and I'm going to show you some of them in universities in Brazil. And we wrote 2 booklets that you maybe find in your tables, and also the how do you call this? Yeah, with the QR codes, and this is a marker, book marker. You can take home and you can access the booklets with this QR code. So everything I'm going to say today is written in these booklets. The methodology we developed was based on a planetary health education framework that is very important if you don't know it to get to read it. And also here, very importantly, Bruno Latour, actor network theory. He's a French philosopher, anthropologist, and sociologist. He passed away a month ago, but he is very, very important in the Anthropocene, because he writes about it in a philosophical and sociological way. So to understand the society where we're living today. And he also writes about nature, so what is nature? Writes about Gaia theory. And the one we're going to use is the actor network theory. That is a theory that connects human and non-human actors in a non-hierarchical way that influence each other and mutually generate cause and consequence. This is going to get a little more clear as we go on. So just to situate, volume 1 and 2 have the same objective. That is to contribute to health, to education of healthcare professionals. So this is meant for healthcare professionals. And just the differences of them, the books, is that the first book is meant for undergraduate healthcare professors and students. And we stimulate that students interview real patients and see them as through the lens of planetary health. And the book 2 is we have written clinical cases, and so that's where we're going to start today. Book 2, the written cases, and we're going to start with Moura's case. Actually, I think we're just going to have time to do one case, but you can find the other cases in the book, the volume 2, and what the key points addressed in each case. So I think it's important to mention all of them. So we have air pollution, biodiversity loss, mental health, syndemic of obesity, undernutrition and climate change, heat stress, inequity, environmental racism, water pollution, indigenous health, the environmental footprint of the healthcare system, food system, promotion of change, and infectious diseases. Though these themes are all covered in the cases. So let's start with Moura's case. This is a case we wrote. It's based on open air coal mine that a big company wanted to open close to the region I live. Fortunately, it is. We think it's not going to happen. But so it's a region that has lots of coal mines, south of Brazil. So I'm going to read to you. This is where it's located, the case. So Moura, a 46-year-old cisgender, heterosexual, white woman lives in Forquilinha, a municipality of 26,000 inhabitants in the rural area of the state of Santa Catarina, Brazil. She works as a cleaning woman in the city hospital and lives with her aunt, Anna, who suffers from chronic obstructive pulmonary disease, COPD, and is treated in the rural health unit. They cook on a wood-burning stove that also serves to heat their humble house in the winter, but the chimney seems to be small for the size of the stove. Only the two of them live in the house, and neither of them has ever smoked. Moura's house is well kept, and the windows are usually open during the day. In the late afternoon, they like to have a mate, that's a kind of tea, on the porch and watch the birds singing in the green fields with native forest. Recently, a company has started digging an open coal mine larger than the size of their town in this field. Moura says that she spends a lot of time every day cleaning the dirt in her house because of the dark dust that is deposited daily on the furniture and the floor. She also says that she is very sad and thinks that this is due to the loss of her quiet green view and the fact that she misses the birds that used to come and eat bread crumbs that she put outside for them. When we do this with students, students will have time to learn. So there's references for each case. And now what is that you're going to do is a net diagram. That is this using this actor network theory that I mentioned before. Okay, so remembering what it is. It's a theory that connects human and non-human actors that influence each other and mutually generate cause and consequence in a non-hierarchical way. So the first task you're going to have is to do this network net diagram. So placing the name of the person in the center of your post, you have this big paper on your tables you can do. And please, it's very important that if you are seeing the online conference, that you get a paper and do it yourself. Because when you have the experience of doing it, you can actually feel what the students are going to feel and learn by doing it. And then you're going to put as many words as possible related to relevant aspects of the person's history, person's story, her comorbidities, individual, family, psychological, social, environmental aspects, everything that appears, and relevant words also. You're going to connect them to relevant words related to planetary health. So we chose these words, but maybe if you can think about other words. So air pollution, deforestation, forest fires, climate change, heat waves, natural disasters or extreme events, equity or inequity, migration, water insecurity and food insecurity, mental health, and infectious diseases. Put as many as possible, connecting these words to the case, and also just direct connections and indirect connections also. Then putting the lines and connecting. You don't have to use arrows. The arrows we use because the software only allowed arrows, but in the paper you can just draw a line connecting, because one influences each other in a mutual way, right? So I'm going to go back to the case. Does anyone have a question? Here is Moura's case. You can read it with your group and select the words, put her name at the center, and I'm going to, when you finish writing the words of the case, I'm going to go back to the planetary health words, because it's not on this slide. So please begin. I'm going to give, I think, 10 to 15 minutes. Okay. If we have time, I will ask you to present your diagram, okay? If we have time. So Are you finished? Yeah? So who is finished? You and you? Yes? Just. You too? Finished? Okay, so where's the mic? There. Can you present briefly your net diagram and why did you do the connections you did?
Because
no, she helped me develop the methods. Can't be her. Yes.
Here, I'll go. No worries. Thanks. So, I mean, we ended up with a spaghetti diagram looking very much similar to what you had up in where it was.
Can you stand up and show it?
Sure. We cheated. They weren't. Yeah.
Actually, Carlos, I think if people at home could see you if you came here. Sorry.
No, I think you have to put it over there.
Over there?
No, I don't know.
So just briefly show to them and then present to us.
So there was a lot of positive feedback loops that we thought of, and so we didn't know really well how to represent. Maybe I don't know if we color coded it, but it ended up just being a lot of positive feedback loops. That, for example, climate change can lead to deforestation, which can lead to more heat waves, that can lead to more climate change, and so on. So that kind of positive feedback loop, positive in the sense that it's reinforcing each other, not that the effect is positive, of course. And then we had kind of closer to Mayara at the center, more kind of proximal determinants to her, so to speak. So we had the mental health issue that seems to be affecting her, some food insecurity, water insecurity, and then the relationship with the aunt, right? The aunt, which is has COPD, that probably she is the main caretaker, and that adds to the mental health issue, but the COPD at the same time is reinforced by the air pollution and the wood stove and so on and so on. So there's a lot of positive reinforcement in our diagram. We didn't get to the maybe all the nuances there, but that's what we tried to do here.
Thank you. No, with you. No.
Hello. Hello. Hi. Okay. I don't. Yeah. Thank you. So a lot of similar things to what you were saying. I think what I realized as I was sort of writing out that I did this late, but I was trying to put group factors, but I wasn't thinking about that initially. But so when we added things like nature, we put them closer to birds. One thing I did want to highlight is that one interest I have is on mental health, so we sort of focused a little on that regarding the grief that Moura may be feeling in terms of losing connections to nature and ecosystems and the social components around that. And then we talked about indoor air pollution and the impacts maybe like closing windows and time, like the time spent cleaning, the time spent as a caretaker. And rural health unit, and I could sort of keep going. Am I missing some? I think that's sort of our method. And again, we sort of went a little, we did a lot. I was thinking of like highways and exits and stuff, and so, okay, that's it.
Thank you. Enrique, can you just show to the camera also? It's good. Okay. Okay. Thank you.
Thank you. Oh, I'll just walk up and show.
Hello. So can you just put it? Okay, our group came first with the words about Mayara. Can you just turn off Mary's stories? And then we put like she lived in a rural area. She had this kind of the situation with the open coal mine, low income. Since she was a cleaning woman. Birds was related to her life. The mental health and loss of nature. Noise pollution, career. Oh, I'm sorry, carer. Yeah, she was a carer. And the situation of her aunt, she was sick. And the wood burning stove, very much related to her aunt, but also would be related to her afterwards. She was a cleaning woman, and she lived in the southern part of Brazil, and the winter is kind of cold. So that would matter, because normally at that time the windows would be closed, closed longer, and this definitely would affect more instead of if it was open all the time. We put inequity here, and then we begin kind of putting the lines, and then we sell the kind of cleaning woman was related to low income, and this would make an inequity. The wood burning stove also related to low income. Rural areas in Brazil normally also is related to low income. Let me just see this one here. Lack of trees plus green space. That had relation to birds and also the mental health, because after it was gone, it really impacted the mental health. The noise pollution was related to the open coal mine, and let me see what else here. The cold climate also related to the kind of the sickness of the ant, and what else? What can we say? Yeah, basically that's similar to the other group, and I don't know if you want to.
What did you link with equity?
What?
What did you link with equity?
The inequity?
Yeah,
inequity.
Okay.
We linked the low income. Well, actually, low income from the low cleaning woman, wood burning stove, carer, rural. It was all related to low income, and this related to inequity.
Mm-hmm. Yeah. Nice. I hope you got the feeling of what it is to do it, and I think when you know a lot about planetary health, maybe this is an easy job, but for students who are getting to know this subject for a first time, and they do all these connections, this is what we want to help them to practice this complexity thinking and system thinking. We also, if you could think about adding other aspects of society also on this net diagram, make it even more complex, right? Yes.
So I was noticing the relevant words related to planetary health. So some of them have got a positive and negative connotation, like equity or inequity, and some of them don't, like air pollution.
Mm-hmm.
Why was that not air quality?
Mm-hmm.
And why was deforestation and forest fires not, I don't know, forest canopy, presence of forest canopy? Why was heat waves not, I don't know, what would they do you see what I mean? It's like, it's geared towards, yes, temperatures.
Mm-hmm.
It's geared towards the negative, whereas planetary health as a term is actually a very positive and fully encompassing notion. So I just think if we had both, or something which was neutral for your terms, that might help people think of, more associations which aren't all negative, and so it can actually lead to positive actions as well as just kind of thinking, oh God, I'll have to stop that. Anyway, I just wanted to point that out. That struck.
Thank you. It's a good point. I think it's because when we were doing this exercise, you kind of want to teach students what's the wrong things and how it influences your health and cause diseases. So Enrique, but excellent. Thank you.
So can I just one minute? So I find your intervention very, very interesting. Okay, so I've been doing this diagram stuff with medical students since 2016, and we started out mapping the challenges, and then we would look for a agency and how to change things, and interconnected, and they just couldn't see it. Like they can't. Maybe it's easy for you guys, but they can't do that. So perhaps what we could do in the next book is to propose a mirror image, right? So if you have dust, you could have clean air, and the mirror in it. So stove, what would you mirror it with? And so that may help people visualize it. I wouldn't put it in the same diagram, because here it's what is, right? As opposed to what we want it to be. And if we do the mirror, it's easier to find the roadmap. Does that make sense? Yeah?
And also, when we do this activity, after the net diagram, oh, sorry. Want to say something?
I was just going to add on. So we do a workshop. This is Calgary, Western Canada, with clerks, so medical students. And one thing that has helped them to see in action has been to view it through a few different lenses. So same sort of problem. They can map the issue, but what do we do about it? So make something actionable and sort of give them the lens of either in the clinic, talking with the patient, as a clinic owner, and this is family medicine and clerkship, or as an advocate, medical educator, something like that. So giving them a lens to prompt them to think about actions helped.
Yeah, when we did it, the students had access to references that are in volume 1, and there are lots of good examples of things that can be done. So they have to study a little bit to do it. And after the NAT diagram, we asked them to propose an individual or family approach. Asking how could we talk to the patient in a way that relates their own health to planetary health, and what are the win-win co-benefits, like recommendation, the patient and environment, could you make to this patient? And also, we asked them to propose a collective or community approaches. So one of the guiding questions are, if you were to serve this patient in your city, what community interventions could you do for promoting planetary health? As a health professional, what could you do in terms of studies and articulations of society, and so on? This is, we're not going to be able to do this now for the time, but it has been very, very nice. Here is one example of with students in Federal University of Health Sciences of Porto Alegre. They're divided in groups, as you were. Here's Professor Airton Stein, Professor Tatiana, and me. So they presented the cases and proposed approaches, individual and community approaches. We use 5 different cases here. So Mara's case is here. We use the other ones. Here, a colleague, Mayara Floss, she did a workshop with residents of 15 residents of multi-professional residency and family and community medicine in Florianópolis, Brazil. And we also used this method with 98 third years undergraduate medical students on the faculty of Botucatu Medical School in São Paulo. This was one of the first. It was in September of 2021, only online. So we did this couple of times online. Also, we did a training workshop with 15 undergraduate medical students of the Field Cruise project that you're going to see an awesome video at the end, because this workshop, using some cases, was to train them, and then they went to interview real patients in the community, and you're going to see the video of this happening at the end of this side event. And we also did it with, like, you can use it with, sorry, not students, you know, people who work, healthcare workers, you can use it with them to explain planetary health. So we did in a family medicine congress. And after some of these cases, we used the method interviewing real patients in a hospital. It was, in the second semester of 2022, with 43 medical undergraduate students, 7 teachers they were family medicine teachers, and in a discipline that is called integrative discipline. And I did quantitative and qualitative analysis. This is actually my master's work. So, and they interviewed real patients in the hospital. So they followed this suggested lesson plan that is on volume 1. They received the pre-class material with text about what is planetary health. Most students didn't know anything about planetary health. They had to answer a portfolio. I will show you what is a portfolio. And I gave to teachers a suggested possible answers for the portfolio. They did an interconnection with a nature activity, and we gave students very palatable study references so that they could study it. And so for students to interview the patients, they had this checklist, and also the teachers helped the students because they are in the third semester, so they are still starting to get in contact with patients. They had to ask all these things, but it wasn't a checklist. It was just remind that you have to ask about this, and then they weren't reading what they had to ask. And they had to answer this portfolio. The activity was, since it was an integrative discipline, it has questions of a lot of aspects in medicine, such as epidemiology, risk factors, histology, pathology, pathophysiology, also connecting to air pollution, connecting to dietary risks, identify air pollution sources of the patient, patient nutrition, and connections with syndemic obesity, undernutrition, and climate change. Connecting questions about heat waves and exposure of the patient to risk to heat waves, the susceptibility of infectious diseases related to the patient, the mental health of the patient. They had to say individual approaches and community approaches also, and they had to look about the healthcare system, environment, and carbon footprint, and to do the net diagram also. They had received the study references. Here is some of the portfolio for teachers with suggested answers. So teachers don't have to be planetary health experts. They can learn with this material. And here are some of the net diagrams of real patients. So this is patient RSR, 51 years, from São Leopoldo in Brazil. She also is a cleaning lady. She has asthma, respiratory infections, and lupus. And they connected with lots of aspects of her life that they could apprehend from the interview. This is another one. And here's some diseases, COPD, heart failure, myocardial infarction. I suggested that they interviewed patients with cardiovascular diseases, so we could have lots of elements related to planetary health. And they did interconnection within nature activities also. They did a trail garden with posters and hung on trees. And there was also a contemplative space. This is illustrative photos, but the real photos, this was the space. The garden, here is one student, here's another one. They are doing this trail in the garden with the posters. One day, I had to do with 2 classes separately, and one was indoors because it was raining. And it worked very well, the indoors also. So this is the example of some posters that were hung on trees. What is nature? What is the limit between nature and not nature? Are you part of nature? What mark is humanity leaving for us and for the next generations? And there is no such thing as throwing it away. Here's some drawings of microplastics everywhere. Just there were like I think 15 signs. This is just one, some so that you can see as examples. So now we're going to do an interconnection within nature activity. Please don't put it yet. Actually, yeah, I think I'm going to start with the sounds. Okay, I'm going to put some sounds just for you to get in the activity and start reflecting about this interconnection within nature. Please put all of them. Yeah. Thank you. And stop now. So the questions that I'm proposing you to reflect on is, so what is nature and what is the limit between nature and not nature? What is this limit? Can you answer us? Me or everybody? And are you part of nature? What are you feeling? Yeah, please. Go, microphone.
When you talk about nature, what comes to mind is it's very soothing, it is calming. And it's not nature, all these honks and all that, very disruptive.
Mm-hmm.
Okay, it just doesn't feel like it's part of me. It feels like it's outside. When it's nature, there is a rhythm that my body is able to kind of take in and feels very spiritual.
Mm-hmm. Okay. Does anyone have another feeling of what's the limit between nature and not nature?
No, I think by definition, nature is anything that is non-human created. So it involves the trees, the sounds of the birds, the sounds of the rolling, the river. So for me, it's nature, like something that is not created by humans. That's why we have built environment, right? So something that really suits me, like whenever I am, like makes me connect with them, makes me in one with them.
Is there a place on Earth that hasn't been touched by humans?
Which is kind of like invaded everything, right? And Earth, I'm not really sure. Like even the Amazon forest, which is really pristine.
And is there a place on Earth that humans are not, that the environment doesn't influence or is not in contact with humans?
I think like it is like humans' connection to nature is very much inevitable. Like there's no way that humans cannot connect with nature, but it's more of like how humans kind of like value the nature that's around them. Like for example, if we see Bhutan, which is very pristine because like Bhutanese people who are living in that area kind of like really valued the environment that they are living in. So right now, it's one of like, it's even net zero. That place is net zero because of like how they value it, how they kind of like protected it.
Does anyone?
Bhutan values, its pristine nature so much that even tourism is regulated. You can't have more than X number of people come at any tourist season. So they value what they have. They believe that they are nature, people living, in that space, in that pristine space. It's so sacred for them to keep it as is. So they have a lot of regulations that help them do that, but not everywhere do you see.
But I think it's an important point is what humans, I understand what to say, what is natural, like not nature maybe, because our nature nowadays, I think we must try to make understand our nature with this other noise, with other things that humans created. So I'm not sure. Well, what I want to say is we have to intend to create, to participate in a nature that we can create new things, but still not destroying what is natural. I think I'm not sure if it's in English if it's okay, but what means natural? Em português?
Fala no microfone. Sorry.
Do que é natural e do que é da nossa natureza, né? Eu acho que o que é da nossa natureza, ela passa a ser também as coisas que a gente construiu. Isso faz parte da nossa natureza humana, né? Sem necessariamente ter que destruir aquilo que é natural.
So it's human nature to build. It's human nature to build. Is that it? Is that it? What you're saying?
Yes. There's a second one. So I had the good fortune of being able to take a walk this morning right here in this vast area of medical services. And a designer by the name of Olmsted, I don't know the year, forgive me, but he carved out a little bit of nature to preserve it as best as can happen right here in the middle of Boston. So I think it's a very interesting exercise as we hold our conference here. We're surrounded by medical provision, and there's that little piece of nature right there. So I just had to share that. Thank you for listening.
You can hear me. So what was your name? Camila. So I love what you said, because I think I was thinking a similar way, that listening to the sounds was, you felt connected to the sound of the birds throughout, as if it was almost like carrying you through, and then you're hearing all of the noise of the bus and everything. That all sounds very disruptive. And I felt more connected to the sounds of the birds, and that was almost like relief. But what I like what you were saying is that if we separate ourselves out by saying, oh, those noises of the bus and the airplane, that's not nature, then we are actually at the same time separating ourselves from the natural world at the same time. So all of it is nature, and we're part of all of it. We're connected to all of it. If we separate ourselves from one, we're automatically separating ourselves from the other. So that's my answer.
And this is very interesting because when we see ourselves apart, we also think, society also thinks that if we harm nature, since it's apart, it's not going to influence us, right? So because, so Tati, do you want to say something also? About this? Yeah. And also one thing, just before she says, is that when we were saying about humans doing, like creating things, you have, what is the limit between like you getting something from a natural source and transforming it when it, like, for example, plastic. When does the petrol, that is something that is found in nature, when it turns not being nature? What is the point? What is the limit? The Anthropocene points to this not separation. Everything that humankind. Before I asked you, is there a place on Earth that humans have not influenced? Every species, and we are influenced by the environment all the time. Please touch.
You could use this.
Thank you. What I believe that you want me to say is a little about a sociological point of view about the separation of nature and human. What is nature? What is culture? By instance, and what we are trying, and Rafaela is trying to show now, that the limit between human and nature, culture and nature, it's subjective. We establish this, but it actually doesn't exist, because even in this visible sphere we are affecting, but we should also think that we are connecting with nature in the micro biomes that lives within us, and we are affecting all of this. So this limit between human and nature, we create these limits. And what we propose, and based on some references, is that this separation between human and nature is part of the problem, background that makes the humanity things that could harm the nature without harming itself. So feeling yourself part of the nature put you in a position that you're responsible for not harming the nature, because you're harming yourself. So that's important. That's not just a philosophical exercise. It's an exercise of how we concept the things. Connecting, not really, I would not just say connected, but understanding as the same is an exercise of sameness, not more than connectedness. We are sameness, same level, more than connected. Because, yeah, yeah, because we connected with things that are separated. As a bridge, we are not separate. What is the limit, you know? I believe that is this, that you...
Yeah, thank you.
I just wanted to make a comment on this, and I don't know how it was in your countries, but in Spain during the pandemic, like a lot of people like wanted to move back to the mountains and the nature and everything, and I think this was a clear example of like where we come from and where we need to come back in times of like crisis, and where people like feel like well and connected and with their rhythms. So like the bit of nature, it's also ours. And I think naturally everyone is like moved towards that. And in the pandemic, it was like a real example of that.
I think there's in the framework, the subject of the topic of interconnection within nature. It is written that this topic has 3 components. One, more of a feeling component, that maybe is what you're saying. Like, I feel better with birds, right? I feel I'm part of this when I'm of everything when I am in a place that has only like trees and other rich biodiversity, and I think I'm part of this. It's more easy to it's easier to feel you're connected to everything when you are in this environment. And there's this component that I think we are trying to say that I don't remember how they call it in the framework, but it's a conceptual I think aspect that when you really look in and think how we are doing now, we can understand that everything that there is no clear limits and no separation. And there's the other domain of the interconnection between nature component, that is the feeling to act. Oh, sorry. When you feel you're compromised to do something. So you feel interconnected and you're compromised to do. I'll go on because we have some...
I would like
to sorry.
Add some reflection about the consciousness and the narrative that we create as we evolve as human beings, as a cultural aspect of our evolution is cultural. Biologically, we are the same 300,000 years, almost the same in biology. But our culture, I think, even more new discoveries, But what is important is that human beings have this nature of, we evolve by not only mutations, but we evolve in terms of how we organize, the way we live, creating stories. And then this story that nature is something else that is not us, is a kind of narrative. And I think it was introduced in the past, I don't know, the history of this separation, but seems to be that the idea of homo economicus, that is represented that individual, that have self-interest, and this kind of story is important to create a story that we believe, and people start acting and thinking and relating with each other and with the nature. And then I think one aspect that we need to change in our work with this planetary health education is changing the narrative. I think I have been working with this, and this concept that planetary health shows, and we need to create stories, work with the indigenous people. They have different narratives. One narrative is that Mother Nature, they represent all indigenous people. They have this idea that nature is the mother, and how you treat your mother. How do you then this is another narrative. I think this is a place to develop this.
Thank you. Now we're going to do an exercise that we proposed with students. That is kind of what we're doing, but we're like thinking, but we're going to feel it in our hands. So just before this, I want to recommend to read about Bruno Latour, because that author that I said right before, he explores, oh my God, it's a lot of slides. Just I want to show you. Here, there. So he also explores this topic about nature. This is a excellent reference for us. So now you're gonna get the stripes, the white stripes that are in the tables, and you're going to do a Moebius tape. Do you know what is a Moebius tape? It is. Here, no, too much. Okay, it's this tape. I did it with tissue. Here, and this is represents it. So what you're gonna do is, let me get one. You're going to write health at one side. So health, or write it in your language also. Which one you prefer. And on the other side, you write planet. Go on. You can get the pens. Okay, done. And that's an easy job. Now, instead of doing this, okay, you're not going to do this. Yeah. The Moebius tape you created by, so it's like this. I'm going to, instead of doing like this, I'm going to twist one end. Okay? Yeah. And I have a stapler here, but I put glue on your tables and tape also. Does anyone want a stapler? Faz tu, mãe. Okay, now start looking at one of your words. So here, I didn't write the word, but I'm looking, supposed to health. Okay. And now just pass your fingers through the tape and see what happens. Just go past it. Done? What happened, guys? Is there an inside side? An inside? Yeah, side. Or an outside? No. So there's no such thing as like something outside or inside. Everything, yeah, it's connected. So this is one activity you can do with students. Does anyone want to say something about this part? Okay. And just another reference from Bruno Latour is this invitation that he makes is like, what about we go down to earth? Well, in which world are we living in a world that has no limits of resources? It seems like we are living in a world that actually doesn't exist. So let's go back to our planet, the real world. Yeah, go down to earth, and so this is the last chart that students saw on the trail. This is the final reflection. Just so that I did some analysis here, the quantitative analysis that students had improved statistically significant. what impact do you think environmental change, such as climate change, have on patients' health? So they improved this. And how interconnected do you feel with the environment? And how important do you think it is for physicians to apply planetary health in their practice? Also here, another analysis, spider web graphic of before. They related how many diseases they could relate to planetary health. Before is in blue, and after they could relate more. Almost all of them were significant. They had significant change. Here, I didn't have time to do the qualitative analysis yet, but some of the sentences they answered me was, what did you think of the teaching methodology? They said the students were protagonists of the learning process, that they found the portfolio and the group presentation very productive. They liked the PDF with the suggested references for study. And I asked, how could the planetary health meetings help you in your professional practice and personal? They said that they're understanding my part as a health professional in developing a healthy environment for nature and patients. Seeing the patient as part of a large whole is key, and becoming aware of this can bring positive impacts for the patient and, if practiced by all, for humanity. Understanding how the context of life and illnesses can be even more interconnected than I thought. It can make me a more ecological human being and interconnected with the environment. Observing my surroundings and readapting my actions in order to reduce ecological footprint, as well as avoiding contact with risk factors. And one said, very cool, the project, innovative, thanks for the learning opportunity. This has been inserted, wasn't just a one time. We have managed to put it as a regular discipline in one of the, actually, in 3 universities that we have done this. So here are some potentialities of this methodology. I have already been through all of them. And thank you. Just let me see the time. Okay, we have time yet. You can find the volume 1 and 2. Please take home the bookmarkers. I did it for you, so you can. We did a planetary health education blog where, if you do something, use a case, or even write a new case, it would be very exciting if you could write a case of a local case, and you could share it on this blog, share the activities on the blog, put photos, okay, and you share it through this link, and then I put it on the blog, and we could share experiences. Now we're going to show a very exciting thing that happened also with students from the Field Cruise project. Please, want to come here? Just to show, okay. These 2 are responsible, and Tati also helped, Enrique, of a project, Field Cruise in Brazil, with 15 students from 2 universities. The students, it was a extension project, right? And students went to interview real patients in the community. So can you pass the video, please? The other video? And this is the video they did, showing how it was. And also after the interviews, the students, they made the net diagram connecting all the aspects and to the patient.
A introdução de saúde planetária nas escolas de medicina é uma necessidade mundial. E o projeto Planetary traz em um dos seus temas esse conceito. A gente desenvolveu um método onde proporciona aos estudantes de medicina praticar e vivenciar a saúde planetária na prática médica, independente da sua formação ou especialidade. De maneira que o estudante ele vai vivenciar isso em todo o período da faculdade, de maneira horizontal, evitando assim os conceitos serem introduzidos apenas em salas de aulas, em grandes palestras ou nos livros. O estudante precisa vivenciar isso. Na realidade do Brasil, onde o território é continental, eles têm a diversidade enorme de populações economicamente, socialmente e culturalmente distintas. Então o estudante de medicina, que em grande parte está em centros urbanos, né, vivenciando prática médica para grandes centros, para cidades, além disso tem características sociais muito peculiares, ele precisa vivenciar isso e aprender na prática como conhecer esses territórios e essas populações. E aí sim, ele poderia praticar a medicina e desenvolver esses conceitos de maneira mais plena e mais efetiva para a população, praticando sim uma saúde moderna, além de voltada à assistência e cura de doenças, e sim as necessidades e a preservação do meio ambiente. É fundamental que esse método seja compartilhado. O projeto Planetary, ele traz essa experiência em algumas faculdades do Brasil e pretende expandir, porque através desse método a gente pode replicar isso em várias outras faculdades, em várias comunidades diferentes, porque a necessidade dessas populações afastadas e vulneráveis é sempre a mesma, uma prevenção e um cuidado maior à saúde.
O projeto Planetary foi criado em 2021, durante a pandemia, numa perspectiva de promover territórios saudáveis e sustentáveis, atendendo a uma demanda de uma comunidade que vive em alta vulnerabilidade aos aspectos ambientais, sociais e econômicos. No nosso escopo geral, trazemos questões relacionadas à poluição do ar e mudanças climáticas. Um dos objetivos desse projeto foi promover a incorporação da saúde planetária no currículo dos cursos de medicina do Brasil, onde estudantes de medicina de 3 universidades tiveram a oportunidade de desenvolver atividades práticas na Ilha de Maré. Essa ilha é um bairro situado no subúrbio de Salvador, capital do estado da Bahia, no Brasil. A beleza natural dessa ilha se contrasta com a poluição do ar, da água, do solo e a perda da biodiversidade. A população também enfrenta sérias dificuldades relacionadas à desigualdade social e o racismo ambiental. Essas dificuldades, elas foram mapeadas pelos estudantes de medicina do projeto Planetary, que permaneceram 3 dias na ilha, observando o modo de vida dessa comunidade, realizando entrevistas domiciliares para compreender o contexto social, ambiental, econômico e cultural da região. Algumas dessas dificuldades foram sentidas pelos estudantes no próprio trajeto de chegada à ilha, como, por exemplo, a falta de pier para entrar nas embarcações, que é um importante obstáculo às pessoas com mobilidade reduzida que buscam por atendimento médico. Os estudantes puderam então experimentar como esses pequenos detalhes podem dificultar o acesso e a saúde das pessoas nessa comunidade. Os estudantes puderam observar que o turismo se apresenta como um importante aspecto econômico desse território. Outro aspecto está relacionado à cultura de base ancestral, como a colheita artesanal de mariscos, a gastronomia local e a produção de artesanatos para a venda. Nesse breve período na ilha, os estudantes puderam perceber como a poluição e as iniquidades sociais poderiam impactar a qualidade de vida desses moradores. Também perceberam a peculiaridade de aspectos culturais da região que impulsionam práticas cotidianas de sobrevivência e são também formas de resistência. Essa atividade de campo na formação médica mostrou-se uma importante ferramenta para aprender sobre a saúde planetária. Foi importante também para promover o engajamento público e cidadão nessa comunidade, contribuindo para um território saudável e sustentável. Entendemos que o planeta e a humanidade estão interconectados. Não é possível ter saúde em um planeta doente. E o projeto Planetary tem mostrado que o tempo de agir é agora.
Thank you very much. This is a great opportunity participate of conference with my project. Thank you very much.
We're right in time. We have like 5 more minutes, but I have finished. We have finished everything we wanted to show you. Do you want to ask something or say comment how it was? How was the experience today? Okay, thank you. Thumbs up. Thank you, guys.